This episode is sponsored by Grow Therapy. Grow Therapy was founded on the belief that quality mental health care should be accessible. It makes finding an in-network therapist easy. Go to growtherapy.com to find your match and let insurance pay for your therapy.
Welcome to a place where you'll leave feeling whole. The Counseling Podcast brings at-home counseling right to you, focusing on self-care, self-expression, and breaking down barriers. Dr. Jaclyn and Dr. Stokes bring over 20 years of combined experience and a new sense of style to the word counseling. The two use humor and lighthearted conversation to explore these deeper feelings. Let's take the stigma away from counseling together.
Hello and welcome to the Counseling Podcast. I am Dr. Jaclyn.
And I'm Dr. Jeremiah Stokes.
We have a special guest today, Matthew Braman, a licensed clinical social worker. Matthew, thank you so much for being here today. Go ahead and introduce yourself.
Well, hi, Dr. Jaclyn. Hi, Dr. Jeremiah. I'm really pleased to be here with you, and I'll share for everyone that I am licensed in New York. I'm licensed in Georgia. I'm an imperfect new dad and husband and new solo private practice owner. I started my solo practice called Verve Psychotherapy earlier this summer. And I am working with men and new dads and their partners. I work with individual therapy and couples therapy and trying to make sure that men have a space where they can show up and feel seen and heard and understood. Beyond that, I have experience working with many people. I had a generalist practice experience working in a child and family mental health clinic in New York. I was working at New York Psychotherapy and Counseling Center, working with English and Spanish-speaking clients, working with 3-year-old, 4-year-old, 5-year-old children through adolescents, through adults, geriatric population as well. And throughout that time, I found many men wanting to work with me. I think for the sake, maybe they had therapy experiences and it wasn't working out so well, or maybe they just felt like they wanted to work on men's issues with a male therapist. And so, I had a lot of experience working with men in that time while I was working in New York. And beyond that, I worked in a adolescent crisis and stabilization unit and working with teenagers, at risk of suicide or violence and psychosis, substance abuse and gang violence. And, during that time, I had worked very closely with the family planning and family program, coordinating discharge and everyone's return home. So I got to connect with a lot of parents who were very concerned about their teenagers' mental health and their stability, trying to make sure that they're thriving. And that experience coupled with a group practice experience working in group private practice, I was very much connected with male clients and moving that into my solo practice journey. I found that there were many therapists who were working with new moms or kind of working from that angle of perinatal care or postpartum mental health. And I wanted to make sure that while I'm kind of working my own personal transition to becoming a new dad, I was holding that space for men, new dads, and their partners.
That's great. And we're going to link your website to the podcast because I want all our listeners to see all the great specialties that you provide. And you've really made like a safe space for men and their partners, like you said.
Yeah, I really appreciate hearing about all your diverse experience. There's definitely a theme, though, that I'm hearing, and that theme is men's mental health. And I'm just really psyched, as a male therapist, to have someone on the podcast who has made that a primary focus in their career, because it's such an area that has so much of a need. And so kind of just off the top of your head, let's talk about men's mental health. What are you seeing out there in your practice? What are some things that you're seeing men struggle with?
Well, especially working with new dads, I find many young men who are dads for the first time, and they're generally just really wondering how to deal with and manage, especially that kind of fourth trimester experience where, their partner is simultaneously going, them together as a couple, they're going through so many mixed emotions. It's just a roller coaster. And, especially trying to connect with a newborn baby, which they're learning by doing. And so they have sacrificed or lost a little bit of their former self and their lifestyle and their opportunity to just kind of, sit back and relax and watch some TVs. And they've got to get up and tend to a crying baby, and maybe they don't know how to hold their baby or how to deal with, the maybe kind of lack of connection they might feel or something like this. And it's also a ripe time for increased conflict and verbal arguments between partners. And so, especially with men, there's the kind of stereotype that, real men get mad, and, they know anger, and of course, trying to work on things like anger management or, dealing with anxiety and maybe kind of like mild, low grade depression, stuff like that.
That's fantastic. So a couple different things. So really kind of looking at a developmental model of, dads and fatherhood, and then how that sort of connects with their own issues, but then also how they're identifying with their children and the changes that evolve in their life once becoming dads. But I also heard you talk a little bit about emotional expression. I heard you mention anger as well. I think that you alluded to the fact that as men, we're kind of conditioned that anger is this like acceptable emotional response, but then other emotions are not. So to tell, what are some of the emotional processes that you see men really struggle with?
Well, if anyone's listening and they've had experience working with a couples therapist trained in Gottman method therapy, they'll be familiar with the 4 horsemen of the apocalypse and that kind of experience of shutting down. And, that emotion floods in, and, they might recognize that it's not the time or place, or, they don't have the outlet to express that anger. And so they go inside themselves. They internalize, they shut down and kind of withdraw or disconnect from either the partner or the baby or whatever it is they're going through at that moment. So I see a lot of men who are coming to me saying that they need to, be able to handle it or to tolerate it and work on that kind of distress tolerance and emotion regulation, especially if they're trying to connect with their partner, where that kind of angry outburst or that kind of lack of patience or frustration tolerance, they might just not be able to connect with their partner in a way that they prefer.
And I know that you emphasized modernizing masculinity and with a mindfulness-based approach, and I want you to kind of share more about that, especially it's interesting for me because I have a 10-year-old son, and I tend to let him know that it's very important to be mindful of your reactions and how you're feeling. So share that with us, how you go about that.
Definitely. There's, of course, so much research going on for all different types of, therapy approaches or methods and interventions. And, with the kind of third wave therapies that are, in some form cognitive based, they're also welcoming those mindfulness based approaches. And, where I really found a connection with my work in supporting men and men's mental health and using mindfulness based approaches, it came from reading a book by Liz Plank. She's the author who wrote a book called For the Love of Men, a new vision for mindful masculinity. And, combine that with a couple other, really solid gender-based resources on men and men's mental health. I found that, slowing down and encouraging that, we kind of drop from our attention from the head to the body, and, kind of work on that journey from your brain to your heart, and trying to, develop that kind of compassion and self-compassion. I found that many men at their core really do love and want to be loved. And mindfulness-based approaches and trying to modernize masculinity, I've found, when you want to connect with clients, we have to speak their language and find that entry point, to kind of get that buy-in to say, like, I'm not just some boogeyman therapist going to prescribe you A, B, or C plan, and it's my plan. Like, they get to connect with their own core self and find those parts of them that really do love and want to be loved. And I find that the kind of loving kindness that you'll find in mindfulness-based approaches, I feel really connects with a lot of men, and by extension with their partners as well.
It's fantastic. And just to kind of bridge some of the concepts that we're talking about here, because you noted earlier some of the emotional challenges that men have that might bring them into therapy. But then you're also talking about approaches to therapy and working with men, some of which being mindfulness based, and being able to kind of merge that. So, like, how would you utilize a mindfulness based approach in working with some of the emotional struggles that you see with men? What might that look like?
I think with so many clients in general, like you can highlight this working with men, but it's applicable, I believe, with so many other clients, is, we have to achieve consensus first, that whatever was happening or whatever someone's plan was before, it wasn't really working out, and they kind of needed a new plan. So I verbalize and I say that out loud and try to achieve that consensus. And so, with that, I try to understand and track, like sequence of events, like what was happening before, like what were you doing that wasn't really working out, and trying to really understand that kind of backstory. And while I'm having this conversation, I'm introducing also new ideas of, like kind of psychoeducation, or educating the psychology of and the neuroscience of mindfulness and the neuroscience of emotions. And I try to talk with especially male clients about something they can connect with. In understanding mindfulness, it's like, we're going to use your brain to change your brain. If I go in maybe a different direction and talk about, like, let's talk about all these feelings, that armor shows up. We, as men, we have this kind of armor that just, it's underneath our shirts. It's a part of us, and it just kicks into gear and we become guarded. So when I'm talking about neuroscience of mindfulness and emotions, I'm educating people about how, the emotions are born in the brain. They move out like teenagers and they show up in other parts of our body. So, I try to help people understand, like, you can't logic or reason your way out of an emotion. You have to slow down. You have to, get some grounding techniques, some relaxation techniques, that box breathing or deep belly breathing. I just introduce a couple of these exercises with a little bit of education, and I normally usually experience some pretty quick buy-in to, help men reflect, like, what was that experience like for you? And they say, I'm calm. I feel differently. I like cerebrally, like logically, rationally, they know that this is going to be the outcome. They know they'll feel better. They know they'll feel more calm. But when we encourage that and hold that space together as therapists and clients, I start to see, a little bit of heart that opens up from there. And from there, they carry it forward with other exercises and meditations, or other kinds of, self-reflective and, kind of inner parts work, you could say. So I definitely work with internal family systems therapy. I work with dialectical behavior therapy, cognitive behavioral therapy, acceptance and commitment therapy. I like to include some narrative-based therapies, and also this one's a mouthful. I'll give it to you with the acronym first. If you're it's AEDP. It's Accelerated Experiential Dynamic Psychotherapy. So all these different approaches, combined, you kind of stir them up. They're different ingredients that I think lead to a lot of treasure. So I tell a lot of men that I work kind of like a pirate, and I'm searching for the treasures. And If this mindfulness based stuff, if it works for you, great. If it's not working, then maybe let's go for some more cognitive based stuff, CBT approach, until we kind of get connected with more of that calm, relaxed state, and then we can open up the heart from there.
And so with all of that, when they're sharing with you, they have to be vulnerable. And I know that you mentioned embracing and modeling the empowerment of vulnerability. So how do you do that in your approach?
It's such a great question. I love to think with men about how they experience shame and how they experience anxiety and guilt. Hillary Jacobs Hendel, she's an author. She wrote a book called It's Not Always Depression. And it's an AEDP based book all about working what she calls the change triangle, which is like a coping resource or like a visual tool. And it talks about emotional defenses, like I mentioned, that kind of armor that kicks in. And she talks about how we want to avoid emotions just in general. And, when they're not safe, they're not comfortable, we avoid them. And usually it's because we're experiencing these inhibitory emotions like anxiety, guilt, or shame. And one of those, maybe all of them, they're kind of tangled up and connected with our core emotions, like anger or excitement or joy or sadness or fear or disgust. So I know I'm giving you this long-winded explanation. I like to connect with men talking about how they experience shame or guilt or anxiety, because in general, I want to create that safe space, like we've said. And those are vulnerable emotions. Those are emotions that, that armor kicks into gear and we want to avoid them. And, in general, I, as a therapist, I may have to lead the way, and I have to embrace and model vulnerability in my own self. So there's, maybe some judicious, brief stories I'll share about myself or what's going on in me during sessions, and I'll open up my heart to clients so that they can see and experience, that kind of co-regulation that might help them kind of find those parts of them that have experienced shame. And so, I tell clients that, shame dies in the light. When we open up and connect with other people and share stories of what made us feel ashamed or what made us feel bad. And, like we're not man enough or we're not good enough, that kind of self-worth. And so, I definitely validate and, reinforce vulnerability as much as I can.
Yeah, because they're protecting themselves, right? And what do you feel like men are, what do you think are those barriers to having vulnerability? And you mentioned shame and you mentioned things like that, but what are they protecting? What do you feel like men feel like they need to protect?
Their manhood. They have been trained and like you mentioned, kind of conditioned or socialized. We're really speaking about bigger influences like culture. And in our culture, cross culturally, men have so many expectations and gender norms and how they're supposed to act and how to be a man. And so, I talk with men about the impact of what's called the man box on their mental health. And this man box, it's very rigid and repressive and makes men think and believe that they have to be strong and be tough, that they have to, be unemotional and stoic and all these things. And so, men and women are experiencing other people police their behavior and correct their behavior when they're outside or acting outside of that man box. And, that makes them want to tidy things up and tighten things up to get back into the man box so that they can protect their manhood.
Protecting their manhood, because it's vital and it's a survival tactic, isn't it?
You're absolutely right.
So then they come into therapy though, Matthew, and I heard a really important point, and that was your point about co-regulation. And I think it's really important for our listeners to understand what that means. So let's say hypothetically a man comes in to therapy and there's that man box and there's that protective mechanism. and perhaps they're not being very vulnerable and they're sort of operating in their normal way, but then you engage in this co-regulation process. Can you tell the listeners what that might look like?
Yeah, I'll give one kind of example where I was chatting with a male client in his 50s, and he was going through so many troubles and conflicts in his marriage, and he was fearful of divorce. And that's something that, of course, many men experience, but just on an everyday kind of interaction with other men, or everyday interaction in their daily lives, where it's probably something they're avoiding, they're not talking about. And so showing up in that safe space where I'm holding that kind of energy for them to be able to let go of that armor and talk about shame and kind of experience these core emotions, I started to cry, and I allowed my tears to flow without interruption. And I showed my tears while my client is sitting there sobbing and crying in front of me, weeping. Of course, we had some rapport, and we had already established therapeutic relationship. This wasn't the first therapy session. We had gotten to know each other over time. And, as a therapist, we feel with empathy for our clients. And I noticed myself, it happened so fast, Dr. Jeremiah and Dr. Jaclyn. Like, it happened so fast. Like, I didn't anticipate. I didn't just show up to my therapy session thinking I'm going to share my tears with my client while they're crying. But I knew in that moment how important it was to co-regulate, to be able to regulate my emotions together with my client, so that they could see that, human emotion, it's a real thing. And I'm not just a blank slate, and I do care about them. And, we were able to talk about what their tears would say if they had a voice, and what my tears would say, and kind of, hearing the feedback from them. It seemed so significant in the moment. They talked about how useful and helpful it was to be able to kind of share that moment together.
That's so great. And you have such a calming way about you, like your tone, and you make it like a safe space. So I'm guessing that when your clients come to you, they already feel that empathy that you're giving off and providing. And you're right, we are human just like anyone else. And those emotions, when our clients are coming to us, it's sometimes, it gets the best of us, and we have to share that moment with them. And that can be a very, beautiful thing for them to see that we're sharing that emotion with them.
And it's that vulnerability too, right? So you're sharing while you're attempting to facilitate and elicit vulnerability from your client, you're expressing vulnerability, and you're operating in a place of vulnerability. And I think that does a couple things. As you mentioned, that can help to co-regulate some emotional processes that are happening, but it also sort of goes against some of those unhealthy cultural norms that you were referencing earlier, right? Like when you're when you're able to express that emotion and do it organically and freely and authentically, it's kind of a way of saying, I don't have to fit into that box that this system and the culture has appropriated for me. I can sort of exercise in my own autonomy, and I think that's really important.
Yeah, and I'll just speak one extra level on the kind of regulation piece, and like you're saying, that co-regulation. It's like we're feeding off people's energy, whether we're at home or work. The dynamics of that interaction and relationship. And so, for men to be able to show up in a space where they can accept and receive the energy that I bring to that relationship in that kind of therapeutic moment. Emotions really love to be seen and heard and understood, and, to be expressed to the fullest in, obviously ways that are safe and therapeutic. And of course, like when we're not in, that kind of safe therapeutic environment, like in the social environment, like in the outside world, of course, it has to be like a safe expression of emotion. The timing of things in that moment, that energy that feeds back and forth, we can experience that sadness or experience that fear or guilt or shame or anger or whatever the emotion is, and actually, collaborate together and be partners in trying to regulate that emotion, which, experiencing and welcoming and sitting with the emotion is part of the regulation. But of course, it could also be like verbalizing, expressing. It could be, using distress tolerance skills, or kind of the quote like mindfulness based and emotion regulation skills you would find in like dialectical behavior therapy. So whether that's like box breathing, grounding techniques, or like self-soothing with the five senses, there's so many kind of emotion-focused, mindfulness-based skills that in moments like that, I spoke about that one particular client, but I'm just trying to make sure that people learn about and get to practice and perform together with me, because therapy it's that kind of dress rehearsal for real life when they're not in the therapy hour.
Yeah, because what does it show? Like going back to that client, and he's able to freely express himself. You mentioned the dress rehearsal. How can he then implement that? Let's say he's guarded in his personal life most of the time, and maybe has been for 50 years. But then in that shared space that he has with you, he's able to express himself. He's able to be authentic in maybe a new kind of way. How does that then transfer into his personal life outside of the therapy office?
Yeah, I was talking with Dr. Jaclyn a little bit of and you about how one of your previous episodes talked about sex therapy, and how, like, especially in like a cisgendered heterosexual couple, like the male partner is wanting that kind of physical connection with their wife, and the female partner or partner, maybe they're married or not, but the woman is searching for that emotional connection. Mm-hmm. And I tell men, like, heart work is hard work, and there's so many different moments where we want to think and logic and reason our way out of an emotion, and it just doesn't work. We've got that armor and we're feeling guarded, and so I talk with men about this kind of emotionally focused therapy concept, like, are we there for each other? And the word ARE being an acronym for, are we emotionally accessible? Are we emotionally responsive? And are we emotionally engaged? And so I talk with men about how, even if it's just the kind of ritual of connection, you're coming home and that first 15 minutes, you see your partner walk through the door, like really trying to like emphasize and highlight how important it is to be emotionally accessible, emotionally responsive, emotionally engaged, and to be able to, really get to the heart of that connection. And, so everything that I'm working on in the therapy session, searching for opportunities to encourage my clients to say, okay, that's the moment where, you embrace that vulnerability, or you try to co-regulate with your spouse or your partner. And, everything that you've been working on here together with me, that's the moment where it's going to hopefully, pay off with that kind of return on your investment in therapy.
That's great. You've shared so much important information already. Is there anything you would leave our listeners with or would want to share?
Definitely. I've been tuning into your podcast. I tune into so many other podcasts. There's one particular podcast I've been, really enjoying. There's so much treasure. It's a relatively new podcast. It's called Man Enough. And the host is Justin Baldoni. He wrote a book called Man Enough, Undefining My Masculinity. And he has co-hosts, which is also Liz Plank, who I mentioned earlier, wrote that book For the Love of Men. And they have another co-host named Jamie Heath, who, together, the three of them, their energy and their guests, they hang in there, they stay in the room, they have uncomfortable conversations about masculinity and undefining masculinity, and trying to, really help listeners just see their inherent value and worth, and know that they already are man enough.
We'll have to have them on this podcast. Maybe get you on again, and we can have a great discussion about it.
I know they would love that. In general, I would say if anyone wants to connect with me, my practice name is Verve Psychotherapy, like V as in Victor. And I like to say that anybody who works with me or reads my blog or follows my social media, they can join me, because I'll help empower their verve, kind of their enthusiasm, their energy, their spirit. I can also be found on social media with, Facebook or Instagram. It's all just Verve Psychotherapy. I certainly want to say thanks for the both of you inviting me and letting me join you here on your podcast. I've been tuning to all your episodes, and I'm really grateful to, share this time with you.
You're so welcome, and you're welcome back anytime. And like I said, we will post all of your information for our listeners. And like always, we thank our listeners for tuning in today, and we'll see you next time.
Thank you so much for joining us here today on the Counseling Podcast with Dr. Jaclyn and Dr. Stokes. Please take this time to thank yourself for putting in the work. If this episode impacted you in any way, let us know with a loving and honest review. If you have any questions or want to continue the conversation from today, you can reach out to us at thecounselingpodcast@gmail.com, and we can answer your questions right here on the show. Or you can find Dr. Jaclyn and Dr. Stokes on Instagram @DocJaclyn and @Dr.Jeremiah.Stokes.